Good evening, friends. Again, meeting in the session of Materia Medica, and today we're going to learn a very important remedy, Kreosotum. It's a wonderful remedy because it has a wide action, well-proved remedy. Remedy is not proved by Hahnemann. This remedy has proved by two important peoples. One person who was from Germany, Dr. Serbium, who was from Germany, and Dr. Vahale from Italy. These two provers who have proved this creosote, it is a distillation of wood tar. And this remedy has made many wonders in my practice. I will going to share one case. It was in around 2015-16. A 22 years girl, tall, slender, very dark complexion, emaciated, was brought to me with by her mother. And she was shy because she was adolescent. She was not able to explain. She was looking towards her mother, and mother explained. Doctor, she had very severe itching of the private parts. Very severe. She cannot control. It is so severe that it is not getting control. And then she explained that this is, she used to itch a lot, scratch a lot, until generally in the evening it used to get aggravated. This is associated with her white discharge problem. It has started nearly about 4 5 years back, and it was started with white discharge. There was a severe discharge which is yellow in color, staining the clothes. It is very offensive, and whenever it starts, the itching gets aggravated. And even it is not there till the itching is present. She had it in between the menses. Around 10 days, 12 days after the menses, she used to get this white discharge, and she used to get a severe itching. It is, whenever it happens, it is so acrid that it burns the parts. That was the thing which she has experienced. Then I took the history. Then she explained that she is having chronic headache since last 2 years, and which is aggravated at the time of menses. It starts the day before menses and it persists during the menses. Then in the past history, she has explained that till she was 15 years of age, she was having history of bedwetting in sleep. We have tried many medicines, many treatments. Lastly, one tranquilizer, because of one tranquilizer which was prescribed for a period of 1 year for her, it has stopped. But it used to happen every day, and when uh, she used to sleep and she used to get the bedwetting. That was very typical. Immediately after sleeping, she used to have that. Then I have examined, and her many teeth were caries. Then I asked regarding the caries of teeth, and her mother told that, doctor, it is there since childhood. The previous tooths also were caries, and even after new one were erupted, there is also caries. This is there right from her birth. So this was the history of the case, and this is the case, nothing more than that. Whenever the question of pruritus vulvi comes, itching of vulva, itching of vagina, itching of pudenda, and aggravated specifically in the evening, if it is associated with leukorrhea, yellowish leukorrhea, forget about any other remedy, think of Creosote first. It is the remedy which gives you magic result. She had been treated by many doctors without any results for leukorrhea, without any results for this pruritus vulvi. But Creosote has that specific thing. So in such types of cases, always use the low potency. You must start with the low. 30 is the better potency to start with in such types of cases, because it is the problem of mucous membranes. It is the problem of just vaginal discharge from the private parts. And the external most manifestation, better potency to be utilized is 30. It has been mentioned that one dose, but I used to repeat the remedy at least 3-4 days. So I have given Creosote 30, and along with that, I used to use one remedy, which you know because I have taught that remedy, the Calendula mother tincture. The Calendula mother tincture in for a vaginal wash daily at the time of bath, and a Creosote 30 TDS. I asked her, just meet me after a week. I have given in half gram and 4 pills 3 times a day. After starting the medicine, she returned after a week, and she said, Doctor, 90% of my problem is settled. I'm so relieved. I'm not, this has not happened in last 1 year, not at all. First time after your medicine, I'm 90% better. Very occasionally, I'm getting itching now. And second important thing, that the discharge was nearly almost absent. So this was the result of it. Then I have continued creosote off and on whenever needed, and she recovered with the remedy. It is a good remedy. Subacute action is there with creosote. Around 15 to 20 days it works. So I have continued with creosote 30, and later on, once a while, she required one dose of creosote 200, but thereafter no more repetition for her. So it is a wonderful remedy in such types of cases. There are many cases of creosote with which for which we can prescribe creosote. The toothache is very important. Creosote many times we require the creosote for that purpose. Then creosote is a very syphilitic remedy, strong syphilitic remedy. So many syphilitic conditions can be treated with the help of creosote. So it's better to go with the Allens, and let us see what he says about the creosote. Open the Allens. Creosotum. Creosote, a distillation of wood tar. The first sentence defines the constitution of the remedy. See, it is very close to phosphorus, but phosphorus is having a skin which is absolutely fair looking, delicate skin. Here, the dark complexion, slight, lean, ill developed, poorly nourished, overgrown, very tall for her age. And in bracket, he has given phosphorus. Phosphorus is very tall for her age. That is very typical with phosphorus. But rest of the thing never matches with the phosphorus. Phosphorus is fair, very delicate. Here the things are rather different. These are the people who are dark complexioned, very important. They look thin, they look tall, but most important thing which you can catch is the dark complexion. Children, old looking, wrinkled like abrotenum. So wrinkles on the face, it looks like a abrotenum. Abrotenum child is also emaciated. Scrofulous or psoric affections, both glandular affections also are there. There are psoric affections are also there. It is a mixed miasmatic remedy, but syphilitic tint is much more in creosote. Rapid emaciation like iodine. Post-climacteric diseases of the woman like lachesis. So post-climacteric, the sepia, the sanguinaria canadensis, the lachesis, these are climacteric and post-climacteric remedy. This is post-climacteric remedy. Hemorrhagic diathesis. Small wounds bleed freely like crotalus, like lachesis, like phosphorus. Flow passive in epistaxis, hemoptysis, hematuria. So it is not an active bleeding. Phosphorus, it is arterial, it is active. In this remedy, it is not active, it is passive, it is more of venous character. Hemorrhagic diathesis in typhoid, followed by great prostration. Hemorrhagic diathesis were dark oozing after extraction of tooth like hemamelis. Hemamelis is a wonderful remedy after tooth extraction. If there is a bleeding is much more, think of hemamelis. That is a good remedy. Roaring and humming in ears. So noises in ears. This is one remedy with deafness before during menses. So this is again a remedy for little bit Meniere syndrome. Looks like Meniere syndrome. Tinnitus is there, roaring, humming inside the ears with deafness. Verbascum is one more important remedy for Meniere's disease. Natrum salicylate is very good remedy for Meniere's disease. Salicylic acid is very good remedy for the Meniere's syndrome. Corrosive fetid ichorous discharges from the mucous membrane. So from wherever it is from nasal mucous membrane, it is through saliva, whether it is leucorrhea, wherever the mucous membrane discharges are there, they are always corrosive, they are fetid, they are ichorous. Vitality is greatly depressed. Whenever such types of discharges happens, the vitality is depressed. So patient becomes so weak, exhausted because of it. Itching so violent towards the evening. See, this is very important feature. Itching is so violent towards evening as to drive one almost wild. So patient tells in a different language. I could not understand, doctor, what to do. I could not control. That is wild. Patient is not able to control. Patient is not able to control the hands. So severe itching. That is typical of the creosote. Basically, itching of the pudenda, itching of the vagina in case of females. So this is a very important remedy. Itching without eruption, dolly coughs. Red light symptom, very important. Itching is so severe, but eruptions are not there. Dolly coughs remedy. Don't forget about dolly coughs. Painful dentition. Teeth begins to decay as soon as they appear. So children's remedy for decaying of teeth, as soon as they comes, they start getting decaying. Gums are bluish red, they are soft, they are spongy, they are bleeding, they are inflamed, they are scorbutic, they are ulcerated. So good remedy for gingivitis, good remedy for carious teeth. The teeth which are carried with spongy gums, it looks close to the murk, but murk, it is more of the crown of the teeth is decayed, and it is murk, it is a long process. It is not at the time of birth. In murk, it is later. Here, it is at the time of birth, very characteristic. Vomiting of pregnancy. So, good remedy for this condition, morning sickness. Sweetish water with dialysm. So there is always a excessive salivation, which is looks like a sweetish in taste. Vomiting of cholera during painful dentition. Vomiting incessant with cadaverous stools. Vomiting in malignant affections of the stomach. So this remedy is very specific for malignant affections. This remedy is very specific for the cancerous cachexia. This remedy is very specific for the syphilitic destructive disorders. Ulcerative stage, ulcers in the mouth, ulcers in the GI tract, specifically in the stomach. This is very important remedy. Severe headache before and during menses like sepia. Menses too early, too profuse, protracted. Protracted, that is means it is a menorrhagia. This is the rubric in repertory. Menses protracted. There is no rubric like menorrhagia in the repertory. Menses protracted. Menses pain during but aggravated after it. So during there is a pain and aggravation even after it. Menses flow on lying down. So they flows more whenever lying down, and that is given in bold. It has meaning. Seeds on sitting and walking about. Very characteristic modality. Very characteristic. So menses, they flows only when lying down. Seeds on sitting and walking about. During menses, cold drinks relieve the menstrual pains. Menses flow intermits, at times almost ceasing, then commences again, looks like to be a sulfur. So metrorrhagia and menorrhagia, both the conditions are getting covered under the creosote associated with leukorrhea. Leukorrhea in between the menses. Then it is very good remedy for bedwetting, which he has mentioned over there. Incontinence of urine. Can only urinate whenever lying down. This is another feature. Many times it happens that they are not able to urinate in standing position. They have to lie down and they passes the urine. Copious pale urging, cannot get out of bed quickly enough, like Apis, petroselinum. Incontinence of urine during first sleep. It is very close to the sepia. At many aspects, this remedy goes close with the sepia. At the female complaints, at the level of GI tract, at the level of headache. Again, this is one more feature where sepia is very close. So incontinence of urine during first sleep, incontinence of urine from which child is roused with difficulty. This is again a complaint whenever bed of wedding is there. The patient's parents always tells you that doctor, we tries to wake him up, but he never wakes up and he passes urine involuntarily. Specifically, if it is in first sleep, this is the remedy. In latter sleep, it is causticum. So we have to understand all those things. This is good remedy for controlling bedwetting. Smarting and burning during and after micturition. So many features looks like urinary tract infection, smarting and burning during and after micturition, like sulfur. Leukorrhea. See, leukorrhea is very acrid. It is very corrosive, causing absolute burning of the parts, offensive. Worse between the periods, that is bovista and borax, where in between the menses, the leukorrhea happens. But this leukorrhea has very typical characteristics that it is acrid, corrosive, and offensive. Leukorrhea has order of green corn. That is another feature. But these features, they are very difficult to get in cases. But sometimes patient can explain. Leukorrhea stiffens the starch. It stains the linen yellow. So acrid, so strong, so corrosive. So it stiffens the pads. The lochia is a vaginal discharge after the, it's basically after the delivery. Lochia is dark brown, lumpy, offensive, acrid, almost ceases and then freshens up again, like conium, like sulfur. So this is one more remedy which you can think post um, delivery discharges if they are corrosive. Think about the creosote again. Violent corrosive itching of the pudenda and vagina. So this is wonderful remedy for pruritus valvi, very important remedy. Relationship, creosote is followed well by arsenic, phosphorus, sulfur, especially in cancer cases and diseases of malignant tendency. So this is a remedy one must understand in depth. Having a depth of action, syphilitic miasm or psychosyphilitic miasm, cancer miasm is very characteristically present with creosote. Carbovage and creosote are inimical, but there are three inimicals actually. Carbovage, the chelidonium, and the carbolic acid. These are three remedies mentioned by Mori as a inimical to this remedy. They cannot be followed each other directly. Aggravation, general modalities, aggravation in the open air, aggravation in cold weather, aggravation when growing cold, aggravation from washing or bathing with cold water, aggravation from rest, aggravation especially when lying down. So these are general modalities applicable to all parts. And lastly, the amelioration, generally better from the warmth. So creosote action is for 15 to 20 days. The antidotes are aconite, specifically in vascular erethism. If it persists of the creosote, give the aconite. That is one thing. And second remedy, the Naxvomika is also antidote whenever there are violent pulsations present in the remedy. After giving the creosote, think of Naxvomika. That is another remedy which you can. So this remedy is a very important remedy specifically for bedwetting, specifically for GI tract affections, the vomiting. Then it is very important remedy for the caries of teeth, and then the female complaints. The hemorrhagic diathesis, specifically the menorrhagia, metrorrhagia, and leukorrhea, then pruritus vulvi. Creosote one should not forget. And use it with confidence. Second thing, don't give single dose and wait. Give it, repeat it for few days and then stop when the action starts. So you can get a very clear cut results with this remedy. So that's all about the creosote. We'll meet again on Monday with a new remedy. So that's all for today. Very good evening, good night, and we'll meet again on the Monday. Any query is there, we'll have a chat, otherwise we'll conclude. So thank you everyone and good night.